All right. Hi, everybody. Welcome back to the Get Healthy Tampa Bay podcast. I'm your host, Dr. Kerry Reller, and today we have Jamie Basak. I should have asked you how to say your last name. Welcome to the podcast. Thank you for joining us.
Thanks for having me, Carrie.
Yeah. Tell me a little bit about who you are and what you do.
Sure. I'm Jamie Basak. I'm a registered dietitian and SOS trained feeding therapist and pediatric detox practitioner. So I have a lot of hats.
And I hope you're going to tell us what some of those things mean in
Of
the future
course.
because your, I guess, alphabet soup is a little bit different than mine. So I don't know what SOS is. And then I don't know anything about the pediatric detox unless it's like your trademark thing, I think, too. So maybe it's not, but I can't wait to hear about it in a few moments. So you're also in the Tampa Bay area, correct?
Yes, I'm in Lutz, near Wesley Chapel, Land Lakes, kind of right in the middle.
Perfect. Okay. So yeah, very, very relevant to the Tampa Bay podcasts. So you've been, I guess, working as a dietitian for a long period of time, right? And
Yeah,
can you
almost 10
tell me
years.
how you got into this special niche of what you do?
I can. So I've been a dietitian since 2015. And through the years, my practice has kind of morphed and transformed into different niches.
Mhm.
And the reason I'm where I'm at today is my own kids. I had at the time, a 3 and 5-year-old, and my 3-year-old had been having like these massive meltdowns for a couple of years. And he's my son. My youngest is my son, my older one's my daughter. And so my son had been having these massive meltdowns, and I would talk to the doctors, and everybody just kept saying, just change the way that you're talking to him. Don't start your sentence with no. And it so I was trying all these things, but I felt like they weren't hearing me. And so one day I was talking to another friend of mine who is a pediatric detox practitioner. She's also a dietitian. And I was like, he's having these meltdowns, but I'm talking like 2 to 3 hours long. And it can literally just be because I told him the grass is green. Like there's no rhyme or reason for it. And I said, this is not a normal 2 to 3-year-old meltdown, like, but nobody's hearing me. And she said, well, I can guarantee you he's high in heavy metals. And I was like, okay, tell me more. So she's talking to me more about how metals can affect the brain and affect behavior and emotional regulation. And then around the same time, I brought into this conversation with her, my daughter who just started kindergarten. She had just turned 5 like a month before this. And all of a sudden she's exhausted. She's 5 and she's telling me she's so tired and she wants to take a nap all the time, having headaches a lot. And she had some skin issues going on. And so I'm telling my friend this too. And she's like, well, she's probably got mold and high copper. And I'm like, okay, so what do I do? And so she actually does the training for detoxing kids. And so I went through her program to just identify. So I ran all the tests. So of course she was right. My son was high in metals. My daughter had high copper, low zinc. She had mold. And so I took her course to get trained and I used my kids as a guinea pig. And they both got significantly better to the point where it was mostly noticeable with my son because of all of our family and friends circle knew the emotional regulation and behavior issues that we were having because most of them had all witnessed them. And
Mhm.
so people, even his pediatrician, like started commenting, like, gosh, he's so calm. He's different. What's different? What did you do? And as I would tell people, that I did some tox testing, we worked on his gut first, and they just started saying, like, oh, I have this friend and their kid could use that. And I have this friend and I know this person. And so that was just kind of, I just started getting referrals just kind of from sharing my own story with the kids. And now my practice is just really niched down to the ADHD population and a lot of families that are interested in that holistic detoxing mold and metals avenue.
So they obviously utilize special testing, and this would be part of your like functional approach to,
Yeah.
nutrition, obviously, because that's very specific, I think, to functional medicine. And being in traditional medicine, we don't cross over as much with those kind of things because, insurance companies don't pay for some of these kind of testing, right? Yeah.
Mhm. Exactly.
You mentioned focusing kind of like on the ADHD population. So you also previously, before coming on, we were talking about the gut brain connection and how does kind of the gut influence ADHD symptoms. So can you talk a little bit about that?
Yeah, so when we're looking at gut health, we have to remember that neurotransmitters are made in the gut, right? And so if our gut health is off and neurotransmitters are not being made and processed and transmitted through that vagus nerve correctly, we're going to have some hyperactivity, we're going to have some behavior issues, impulsivity. So when we really work on the gut and we really balance the gut bacteria, parasites, candida, whatever it is that might be going on, we see a big change in our kids just from that piece. Because now the gut and the brain are talking better, neurotransmitters are flowing, we're absorbing nutrition. So they're absorbing the magnesium and the iron and the fish oils and all the things that our brains need. And so that's kind of how that gut brain with ADHD works.
Are there common like gut related symptoms that you see in kids with ADHD that often go unrecognized?
Not really unrecognized. A lot of my patients will have constipation. And when you think about that,
Yeah.
if we're not pooping every day, toxins are sitting in the colon, they might start to recirculate. Those metals specifically can mimic other vitamins and nutrients. So these transmitters and receptors that are looking for, I'm just going to throw like a zinc out there. If we have a metal that gets into that transmitter instead and goes to the brain, then we have these symptoms come up. So the first thing I always work on is that gut health to make sure that they're pooping every day. Yeah.
Other than constipation, what kind of things do you see?
In gut health?
Well, just the combination, right, of the like ADHD symptoms and the gut health. So maybe that the parent is not noticing that, the gut health or gut symptoms are related to that, like related to ADHD symptoms. So what kind of things might they see on the ADHD side versus.
Oh, okay. Yeah. So the typical hard time focusing, impulsivity, hyperactivity. And then, on the GI side too, it can be, maybe the kids aren't, maybe they're going every day, but they can still be constipated, right? Even if they're going every day. So I kind of ask really in-depth questions to really find out if we're like going completely every day. And then some of the kids will have, parents will say they notice reflux with their kids, or they're always complaining of a tummy ache, or they're real gassy. And, all of those are just signs to me that the gut's just not functioning optimally. And so we have to start there.
So they may have noticed some of the more apparent symptoms like the hyperactivity and attentiveness, maybe like the meltdowns, like you mentioned. And then, it comes to light that, okay, so there might be some GI things going on at the same time. Yeah,
Mhm.
interesting. Okay. What do you feel like that parents are feeling? Do they feel like alone, unsure, like when their child is struggling with these kind of things? Like how do you see them coming in the picture, like to know where to turn to?
Yeah, I know I did. I didn't know where to turn because it's just not something I think that all practitioners are aware of, like the different signs to look for, especially when the kids are real little. I felt very alone and I kind of felt as a mom, like I think my biggest thing was I am his mom. How can I not figure this out? Like, how do I not know what is triggering these meltdowns? How can I not help him in the middle of a meltdown? Like, this is my only job as a mom is to like be there for my kid, keep him safe. And I don't feel like I was doing that. So I have a lot of parents I think feel that same way. They feel alone. They maybe feel invalidated because they're just not sure. Like they have that mom gut feeling of I really think something's going on, like there's some neurodivergency here, but I don't know for sure. And I don't want to label my kid if that's not what's going on. So yeah, I think a lot of my conversations initially with the caregivers is validating that of like, when it's your baby, like if
Mhm.
something's off. And then it's my job to kind of help you peel back the layers of the onion and figure out where the root cause is so that everybody can be happy.
Yeah. So me as a mom, I have three kids. My interpretation of some of these meltdown type things is always like, okay, so we allowed too much sugar, they didn't get enough sleep, those kind of things. How do you make that distinguishing difference? I think when there's might be something more wrong, like with the things that you're saying, like with the nutrients and metals and things.
I think when you rule those other things out, so like a great example this past weekend, my kids had way more Easter candy than They don't get food dyes, they don't get sugar on the daily basis, processed sugar, and they are in bed at 7 every single night. Like that is just we are home for bedtime every night. And so this weekend was rough because we weren't home for bedtime. They did have some food dyes. They had their Easter candy. And so I think like just kind of sometimes I'll have parents keep a log. Like what time did they go to bed? What did they sleep okay? Do you hear them up a lot? Do you hear them talking in their sleep? What is their diet like on the regular? And I'll help them kind of dissect the diet too, because sometimes they'll say, no, 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 we're dye free. And then when we're going through a food journal, it's like, well, he had Doritos for lunch. I'm like, well, hold on, because people don't know that there's red dye in Doritos. A lot of people, we're thinking candies and ice cream and, those processed foods, fruit roll-ups, like the obvious stuff. But then there's other things that we don't always realize.
Doritos are definitely processed foods, right?
Processed,
But yeah.
yeah. But yeah, a lot of times I'll start with the food dyes. If somebody's really new to the journey and they haven't kind of been doing research and cut out dyes and all that. But just an example, like sometimes things are kind of hiding in there. And so as far as to your point, to figure out, well, was it just tired or too much sugar or, maybe low blood sugar? Like that was a big one for my son too, that I didn't realize he was getting hangry more often than like my daughter would. Like she can go 4 or 5 hours. She'll eat a good meal and then she's okay. He needs food like every 2 hours or we're in trouble. And so
Mm-hmm.
kind of peeling back those layers with parents and really looking at the day to day and what the kiddos are actually eating and all of that, that helps me kind of peel that back. And then the stool test too, to see what's going on in their gut can give us a lot of information when we're not seeing anything, like it's mom who's done all the research. We're dye free, we're sugar free, we have a good sleep schedule. The kiddos eating fruits and vegetables, they're getting fiber. All these boxes are checked off. Then that's when I'm kind of like, okay, we need to dig deeper. So let's start with some testing.
So what are some of the most important nutrients for focus for brain function in kids?
Brain function is like magnesium,
Mm-hmm.
their fish oils. A lot of kiddos, especially our ADHD kids, are deficient in the omega-6 GLA. And
Mm-hmm.
so getting a good supplement that has a good balance of the omega-3, 6, and 9, and having enough of that GLA in there for them could be really nourishing for their brain. And for focus, zinc, iron too. Like I always want to get a full iron panel because if their iron's low, they're going to have a hard time focusing.
Mm-hmm. Okay, so iron, and then you said zinc, magnesium, the omega three,
Yeah.
six, nine
Mhm.
combo. What GLA? I'm more familiar with EPA, and what is GLA?
Exactly. GLA is the you're gonna make me pronounce it. It's like evening primrose oil also is the same, but a lot of our supplements don't have that one in there. So there's a couple specific ones, and then you want to get the right ratio too. I always use the New Beginnings nutritionals. I love their line. They're very specific for autism and ADHD brain health. So they have a great
New
selection
beginnings. Okay.
without having to do a ton of research.
Yeah. Okay. So that's definitely good information. What can parents start checking or addressing like right away if you can't do labs or anything right away?
I'm always going to look at diet first,
Mm-hmm.
kind of the low hanging fruit. So diet, making sure that they're getting enough protein because we need our protein for neurotransmitter production. Fiber, make sure that we're pooping, make sure we're pooping every day, and getting kind of the rainbow of fruits and veggies so that we're getting all different types of prebiotics in there too to help balance the good bacteria in their gut. And then just kind of looking at their diet too and seeing like, okay, well, we're not eating any fish, so we probably should do a fish oil. If they're, depending on their symptoms, if they are hyperactive, if they're having a hard time sleeping, like I'm going to recommend a certain magnesium for them. And I just kind of dose that based on weight and symptoms.
Mm-hmm.
I really like to get labs first though, so that we kind of know where our baseline is before we just start supplementing. But those are a
Mm-hmm.
couple of good places to start.
So obviously very important things that you recommend, but I myself have trouble like getting my kids to, excuse me, eat their protein, fiber, and rainbow of veggies, one 5-year-old in particular, but I don't know if you have any tips or tricks for making sure they do that, or I don't know.
Yeah, it depends on the kiddo. If they're super picky and they're only eating like 20 to 30 foods, that's where my feeding therapy training comes in, which is the SOS feeding therapist that I was telling you about. So it's just a very strategic way on how to introduce new textures and foods and things to kiddos who are maybe like super picky. And so I would start there before just like throwing them a plate of broccoli and telling them to eat it. But if they're eating a good amount of food and it's just like I know even my own kids, it's vegetables. And so
Mhm.
we'll make like brownies and I'll let them grate up zucchini that we'll put in there. Or if we do banana zucchini bread, like letting them help put, and
Mhm.
I don't ever recommend hiding stuff in their food because if they find it, they're not going to trust you when you are giving them stuff in the future, and we might ruin one of the few foods they'll eat if they are a really picky eater. So I
Mhm.
always just include them in it. Like, let's make a smoothie. We'll put a little like one spinach leaf in there. You won't even taste it. And then we'll do it and they'll try it. And then maybe we can add two spinach leaves tomorrow. So just kind of, I help parents come up with creative ways to include the kids into bringing those foods in.
Yeah.
Mhm.
I mean, I think they love like cooking and participating in that. So I think that's a really good way to do that for sure. Are
Yeah.
there any like certain foods that tend to worsen ADHD symptoms?
Outside of the processed foods and the food dyes and the processed sugar, I think those are the big ones that I would
Okay, so
say.
just really the, ultra processed foods. Yeah.
Yes. Yeah.
Are there any like common mistakes that families make when trying to clean up their child's diet?
Usually if I'm on the case with them, the things that I notice is maybe like pulling all the foods at once, right? Like no more Doritos, no more Fruit Roll-Ups, no more gummies, no more popsicles, like just pulling it all at once. That can cause a little bit of trauma for kids as far, kind of trauma around food. So I always just recommend like pick one thing, pick a popsicle that is dye-free and have them try it and just replace as things run out. But have the kids be part of it. So the smaller the younger they are, the less we really have to explain. But as they get older, like we can explain. So, the red food dye and those fruit roll-ups that you really like, I think, that's part of why you have a hard time focusing at school. And so let's try these fruit roll-ups. They're still fruit roll-ups, they're just made with beet juice or whatever it is. That's not a red number 40. So kind of helping educate the kids too, because the older they get, they're tending to want the support also. They don't like that they can't focus at school. They don't like that it takes them longer to maybe finish their tests or, do their things. And so I just include them as much as I can in the process with mom or whoever is taking care of them so that they feel like a part of it and they understand why. Because a lot of times, if the kids know the why, they're much more willing to try different things.
Mhm. So didn't we also ban red dye recently or
There was one, I forget which number it was. Yeah, Virginia that just banned it starting in 2026. So it's starting.
somebody did. I mean, I thought the country did recently. I kind of forget the whole details of it.
I didn't know that the whole country did.
Yeah, we'll have to check back on
I,
this then
I do
because
live under a box sometimes, so kind
see
of
here.
missed it. Yeah.
Yeah. Okay. Well, we'll look that one up so we can
Yeah.
address it later. Because I'm
Yeah.
pretty sure, I mean, obviously, I mean, just thinking of a big Instagram person, I think, what is it, Food Babe? I think that's her
Oh,
handle. And she
maybe.
does all the differences between the UK products and the US products. And it's just
Yeah.
crazy what is in our foods compared to what is in even what the UK bans, you know?
Yeah, it's crazy the differences. Same product, but
Right. Yeah. So
ingredients. Yeah.
you alluded to this pediatric detox. Can you tell us a little bit about what that means, why detox might be relevant for maybe a neurodivergent child?
Yeah, so our autistic and ADHD kiddos specifically, they tend to just not detox as efficiently as maybe a more neurotypical kiddo would. And there's not like a ton of research with exactly why that is or which genes are where the blockage of that can be, but they just tend to need help with detox anyway. So what I generally will do is help open the detox pathways, so make sure they're pooping, peeing, and sweating every day, making sure they're getting enough water, getting enough time outside playing, make sure we're pooping. We'll do like some Epsom salt baths to kind of help slowly just pull some toxins out. But that's usually where I start. But the reason for detoxing is because, like I was saying before, these molds and metals, they can mimic things, and they can get into these transmitter receptors that are for vitamins and minerals, but these metals specifically will get into those transmitters, and then they can cross the blood-brain barrier. So if we're taking metals to the brain instead of omega-3s and omega, 6, 9, B vitamins, we're not nourishing it with vitamins, we're taking metals. That's where a lot of our symptoms come from with our neurodivergent kiddos.
So are there, I guess, I mean, we've kind of already alluded to this, but are there any signs that a child might be dealing with environmental or heavy metal toxicity?
Heavy metals specifically, a lot of my more aggressive, anger-prone kiddos, if I have a lot of aggression and anger, like that's my first thought is to confirm or rule that out as metals. Molds can kind of have all of the same effects, but molds, a lot of like fatigue, skin issues can cause constipation. They all can kind of do that, but the metals is the one where when I get the real aggressive and hyperactive and things like that, that's kind of where those red flags go off for me.
Mhm. Okay. So you also have this, I think this is so cute, but the Little Neuro Ninjas. Can you tell me
Mhm.
about that and what can families expect if they join that?
Yeah, so that is my program. So we have sessions where, well, they get my pre-recorded class basically on reasons for detoxing. It has a whole section on what detox is, where the toxins are found. So like where could your kiddo be getting exposed to these things? Different ways to change things in the environment as much as possible to be a little bit less toxic. And then I have training on the gut and how the gut matters with detox, with nutrition, different ways to get different herbs and things into our kiddos' foods to help support their detox system. And then while they're kind of going through that on their own, we're meeting for our first session. And then that's where we're determining what tests do we need for this kiddo, like specifically, what are their symptoms? What do I need to look at? So at that first visit, we'll do the assessment and then we'll order any labs that we need. And then they're kind of going through these modules to kind of get educated on why we're doing what we're doing. And it teaches them how to prime the kid's body for detox. So when we get to that point, the kiddo is ready to go. Like we don't have to spend any more time priming, we're primed. Like pathways are open is what that means. And then we'll do another visit usually about 3 to 4 weeks later to go over the test results and kind of set up a protocol. And then usually 4 to 6 weeks later, we'll do another visit to kind of assess how we're doing and kind of set up a maintenance plan. And because I teach parents how to keep the detox pathways open so that they're not coming back to me in 6 months with the same issues that we just fixed or
Yeah.
supported. Mhm.
Nice. So what kind of results or any good stories that you've seen through this approach?
Yeah, I just had one little one recently who's 4, and ADHD was suspected, not diagnosed yet because he's only 4. But we did the stool testing. We did a lot of work on his gut. He had candida. He had a couple of parasites. He had really impaired digestion. So we worked on that. As we were working on that, he was also a very, very selective eater, wouldn't eat any protein. So about 4 weeks into healing his gut, he asked for a hamburger. And mom was just called me and she's like, "You're not going to believe this. He just ate an entire hamburger." I'm like, "I believe it. I do." Because a lot of times our picky eaters, especially when they're little like that, they don't understand that they shouldn't get a tummy ache if they eat a hamburger. So they just don't want to eat it. They're not telling us, when I go poop, it hurts. They just don't want
Mhm.
to poop. So then they're constipated and withholding. So when we fix the gut, a lot of times our picky eaters will start to at least be more willing to try foods because their tummy feels better.
Yeah. What
Um,
was he eating before? And then what was he eating kind of after?
yeah, his diet was yogurt, goldfish, Cheez-Its, bananas if they were really, really ripe. So if you notice a trend there, very easy to digest foods,
Mm-hmm.
things that don't hurt his tummy when he eats. He would eat, I'm trying to think of what else. Chicken nuggets from Chick-fil-A, but only the breaded ones, not the grilled. But that was his only protein source. He would eat string cheese occasionally, but very limited. And now he's up to about 30 or 40 foods. And we've been working together since October. But he's also focused better. He's not hyper and he's in VPK. Mom's not getting calls every couple of days that he's literally standing on the table or, throwing chairs down or things like that. Like behavior is improved because he's feeling better. So he's able to be calmer. He's not, he doesn't have a tummy ache and he's not feeling agitated because we've got his gut fixed. We replenished a lot of nutrition. We did my urine test to look for vitamins and minerals, and he was depleted in a lot of things. Magnesium was one. I can't remember all of them off the top of my head, but a lot of the classic ones. But I really think replenishing the magnesium is what made the biggest difference for him specifically.
Mm-hmm. So you mentioned he's up to like 40 foods. Like what kind of things is he now eating compared to the other things?
Yeah, so he's at least trying at least cooked veggies that mom will make, and she'll give him, I teach to do a separate plate next to the dinner plate as kind of like a maybe later plate if they don't want to eat it. So mom will start new veggies and things on that plate, and he's at least trying them. He's eating his hamburger, so she can put hamburger in spaghetti sauce now.
Mm-hmm.
She can make him hamburgers. He's doing chicken if it's still like rotisserie chicken texture, like still kind of soft. He's taking beans now for her without a problem. Lots of different fruits. We're working on more proteins, but I'm super happy with where he's at protein wise now, because that's only going to help neurotransmitter production too.
Yeah. Do you have any idea if mom was cooking these kind of things, but he just wouldn't eat them before? Or is this
Yeah.
something, did she overhaul her, diet as well?
No, they were referred to me through his speech therapist
Mm-hmm.
because she had kind of evaluated, oral motor, oral motor wise.
Yeah, sorry.
It's too late for coffee, right? Everything was fine. And yeah, mom and dad make normal, she would have a protein, a carb, a veggie with each meal. She would offer fruits and, he would only eat one type of yogurt. She would offer different yogurts. He just wouldn't take them.
Mm, interesting. Yeah. Well, it seems like you've definitely turned this kid's life around. So that's awesome. Yeah. So what advice would you have for parents who kind of do feel overwhelmed, unsure, kind of where to start?
I would say to take a deep breath. And, the thing to start with, I really feel strongly about is assessing, sleep, diet. Are we getting food dyes? Are they getting a lot of processed sugar? Are they drinking lemonade and Gatorade and all of that? Because those are going to have sugars and dyes most of the time. So a lot of the things that we just maybe don't think about. So just kind of really looking at everything that they're eating, make sure they're getting enough sleep, exercise, things like that. That's kind of like a nice foundation. Once all those things are in place, if you're still struggling or, if they need help with the food part, that's what I'm here for. So.
Mhm. Yeah. So I guess if it was just one thing this week they could do to support their child's nutrition and behavior, what would you suggest? Because you suggested a lot of things, but
Yeah, just one thing. I would say pick a food dye, pick one, and just try to get it out.
get it out.
Yeah, start it one at a time.
How many are there?
Oh, geez, probably
Like
too many
way
to
more than
count.
to count.
I
Okay.
think so, yeah.
Yeah. Yeah. Yeah. Well, we'll have to look up whether whatever, legal thing happened recently. I don't know. I
Yeah.
don't think it's enforced yet. I know that, but I just didn't
Yeah.
know when it would be, or I can't remember what it was, but I'll look it up. But
Yeah.
anyway, where can people find you if they want to, learn more about your services or work with you?
Yeah, I have my website, lokahinutrition.com. Also find it littleneuroninjas.com. I'm on Facebook under my name, Jamie Basak. I'm on Facebook under Lokahi Nutrition. Those are probably the two best places to find me.
And can I ask, why did you name it Lokahi Nutrition? I think it's very unique. I don't know what it
Yeah, it
means.
means balance.
Oh, okay. Very cool. All right. All I think is like Hawaii. I
It
don't
is
know.
Hawaiian.
Okay,
Yeah.
perfect. So I'm
Yeah.
not
See,
losing my
you got
mind.
it.
That's a
Yeah.
great, great name. I love it. Yeah.
Thanks.
Awesome. Well, any final words of encouragement to any parent or person listening today?
I would just say that, you're not alone
Yeah.
and they're validated in the feelings on if there's something going on with their kiddo. And I'm here to help if I can support in any way. So
Awesome. Well, thank you so much for joining me on the podcast today. Everybody tune in next week for next week's episode, and we will put all of your information in the show notes. And yeah, everybody
cool.
stay
Thank
tuned for
you.
next week.
Thanks for having me.
All right. Yes, it was a pleasure.
Thank you.